On to a story we highlighted for you at the beginning of the broadcast, and it's on Health Watch. The Kenya Union of Clinical Officers has threatened to stage a nationwide industrial action starting midnight due to unfulfilled promises by the Ministry of Health and the Council of Governors. The union alleges delays in signing the approved 2024 collective bargaining agreement, absorption of universal health workers to permanent and pensionable terms, and payment of salaries arrears to the Global Fund staff. The union has accused the Ministry of Health of laxity and lack of goodwill, vowing to stay out of work until all their demands are met. Kasichana Masha compiled this report.
The 21-day strike notice issued by the Kenya Union of Clinical Officers on December 2nd, 2025 will lapse at midnight. The union was decrying of delay in the signing of their approved collective bargaining agreement, implementation of their return to work agreement, payment of the Global Fund staff, the absorption of UHC workers on long-term contracts, among others.
We are talking of a CBA that have been negotiated for 8 good years, several agreements that have been made without being met, especially from the part of the government. The last agreement is the one that we are talking about of July 8th, 2024, had a strict timeline that the employer has not observed.
We had been invited by the Minister of Labour in effort to be able to restore to ensure that the continuity of the service is in our public facilities, both at the national government and the counties, continues. But we are surprised, the national government, which is the Minister of Health, which is led by Honorable Duale, they have declined, or they have refused to be able to come on the table and be able to do the needful.
Addressing the media on Monday, the union officials led by their chairperson Peterson Wachira and Secretary General George Gibore say they had given the Ministry of Health and Council of Governors 1 year to address their grievances, but they have failed, terming it a sign of no goodwill.
SRC has already given its approvals. The CBA is printed and has been with the CS for the last 3 months. He has not found some time to put his signature on the CBA.
In all the county governments, but about Nairobi, we have entered into an agreement and signed a return to work agreement that was on July 16th this year. And then they have not honored any of their agreement, any of these agreements. As we speak now, all healthcare workers, all employees of Nairobi County do not have a medical cover.
The union has threatened a nationwide strike starting at midnight, withdrawing at least 80% of services in public health facilities.
But after today, midnight, we are proceeding on strike, and that includes all clinic officers together with clinic officer specialists and clinic officer interns.
So bad that it is going to be holiday session where we see an upsurge of diarrheal diseases. People who travel to malaria-prone issues go and come back with a lot of malaria, issues of road accidents, and there are not going to be people to help these people when they come to the hospital.
The union now awaits a formal response from the Ministry of Health and Council of Governors, and if no agreement is reached before midnight, Kenyans will miss some critical healthcare services. Kasichana Masha, Prime Edition.